So, good evening. Actually, it's good evening right here in California. I do have the list that I have for my content of the video. So, the title of my video is not How, My Experience and Advices Working with COVID-19 Patients. So, for those of you who does not know, I actually work in positive COVID patients. Yes, not a lot of people know about it. I tried not to tell my friends just because I don't want them to be scared about hanging out with me. But I actually don't hang out with a lot of friends since COVID started just because of that purpose. I chose not to see friends, not only because I want to protect them from not having the COVID. Well, I guess that's the only reason why I don't want to see my friends at this time. It's because I don't want them to, I don't want to spread COVID. Although at work, they do actually test us for COVID-19 at least twice a week. So I think it's very generous to test your staff twice a week compared to just once a week. So just in case I get exposed, let's say I get tested Monday and even my result came back and it's already negative, but at least for those gap that maybe I got exposed with patient with COVID, that I'll get tested at the end of the week. So even though I know I am actually negative for COVID, I still want to protect my friends and also my family members or close family members to make sure they don't get the COVID. Part of what I did before is I do test the patients and also our staff for COVID testing. The only thing with that is you don't know that a couple of days later that the one you actually tested are positive. And there are times also where a positive COVID patient, we need to test because it is a requirement for the place that they're gonna be placed to have them negative first. So we have to test them, and sometimes it comes back and there are actually still positive. And sometimes I'm get really close to them because you have to go dig into their nose to do those testing or swab their inside of their nose. So I could say that I got really close to them oftentimes. So I feel like protecting myself, protecting other patients, protecting other coworkers, and protecting people that leaves or I get close to when I'm not at work is really critical. So one of the things that I should say is in order for me to protect the other, I have to protect myself from COVID-19. So some of the advices, I came up with 4. I know there are more advice that we should be giving or CDC is recommending to staff who work closely with patient who is positive for COVID. But I came up with 4 because I feel like doing this 4 is already a lot. Like it already covers majority of the thing, besides cleaning your stuff and all those. But this 4 is just to protect yourself. Number 1 is protection. So always wear your proper PPE. PPE stands for personal protective oh my god, PPE equipments. Sorry, I got blacked out for a second right there. So personal protective equipments, pretty much it consists of N95. So of course, when you work with patient with COVID, it's not just a regular surgical mask, never a cloth mask, but of course, N95, face shield, proper face shield, gowns that cover your arms also, and also gloves. So right before you walk in the room, you want to make sure that you double check yourself. It is not only just having the protective equipment and you're wearing it that means that you're gonna protect yourself already, but wearing it properly helps a lot. So you're lessening the risk, your risk to get the COVID by wearing everything properly. So if you're not familiar, make sure you ask someone at work, make sure you ask the management on how to make sure that they properly that you properly put it on. So the second thing that you have to do is you have to make sure that you know what clean and dirty means. So anything that you are exposed with the patient. So for example, if you have face shield, you know that these are exposed to the patient because they can accidentally cough, and then all the particles in the air, you don't know. So you want to make sure that anything that is dirty when you come out of the room, you have to remove your gloves, right? Before you come out of the room, gloves, your gown, and then also you have to do hand hygiene. And then when you come out of the room, you know that the facial is dirty, so it is not something that you should place anywhere. For example, if you do have the carts that you use, or if you do have something that you know that are clean, don't place all your dirty equipments, like for example your pens, your stethoscope. So make sure that after you come out of the patient room that you have to make sure that you do clean and sanitize all those equipments, because what you don't want to have happen is to cross-contaminate the dirty and the clean, and then ended up like bringing it to the other patient or something like that. And that applies not only to COVID but also to every patient that you're gonna take care of, whether they have COVID or they don't have COVID. And the third one is hand hygiene. We touch everything with our hands, whether it's bare hands or gloves. We want to make sure that before, because they always say before and after we touch anything, that we want to make sure that we wash our hands, or at least do a hand sanitizer. But as much as possible with the COVID, we want to make sure that we wash our hands as often as possible, or even every time we come out of the patient room if we have a chance. Because there's not a lot of people, well, majority of the people that works in the COVID unit are wearing their proper PPEs, but at the same time there are higher risk to get it because they're actually working with a patient in a close contact. That's why they always recommend to make sure that you clean and sanitize everything when you're in a patient room, to make sure that it don't pile up. The fourth one is avoid touching your faces. So if you are working with a patient, I know I always like touch my face or touch everything. As much as possible, I don't touch anything right here because our portal entry are literally right here. So your eyes, your nose, which is entry to your respiratory, your mouth, it has a mucous membrane that that are highly vascular in certain areas. So as much as possible, we try not to touch anything this way without washing our hands. With 4 of those, wearing proper PPE, make sure you know the clean and dirty, hand hygiene, and also not to touch your face. Those are just the basic advices that I could give to you that I think and I feel will help you when you work with patient with COVID. But my recommendation is when you work with anyone, any patient, anytime you work with a patient, you want to make sure that you think that they have something, because that's the only way that you know you have to wash your hands. If you feel like the patient have COVID, even though they don't have COVID, or if they have some certain conditions or certain viruses that we can highly get from them, even though they're negative and they're not confirmed, you have to make sure that you treat them as if they have that highly contagious infections, because that's the only time that we'll wash our hands. That's the only time that we will take care of ourselves, and then we will do a lot of protection because we don't want to get it. With all these advices, we still don't know even if following all this or following all the CDCs and everything. And sometimes, because we're all individual, we all have different immune systems and all those. Sometimes we don't know that we might get it even if we're really careful about a lot of things, because we are exposed with the outside environment too, not just because we are working with the COVID positive patients, because we go to the groceries, we get, we see people outside that we don't know, maybe they are positive or not. So the only thing that we could do, I guess, in my opinion, is to pray, to make sure that hopefully we don't get it at the end of the day. And the worst thing that we could do is to actually spread it from ours to other people. So be careful out there, and make sure that you try to follow all these advices that I have as much as possible. Thank you. Bye bye.